Glasgow Coma Scale. Regarding his mobility, BR requires moderate assistance times 1 for sitting balance. BR requires moderate assistance times 2 with standing balance. Transfers, he requires moderate assistance times 2. Non-ambulatory and assistance is needed for wheelchair mobility. His perceptual and cognitive impairments include impaired perception of auditory and visual input. He has difficulties with attention and concentration and has trouble with short-term and long-term memory and displays poor reasoning. He has problems with organization and categorization of verbal material, and decreased language comprehension is noted. Regarding his affect, he exhibits impulsivity, reduced insight, and inappropriate emotional responses. For occupational performance, he requires moderate assistance times 1 for all personal care. Now let's learn about the pathophysiology of a traumatic brain injury. The brain tissue damage that occurs with a traumatic brain injury can be categorized as a primary injury or a secondary injury. A primary injury is when there is immediate damage to the brain. It is the injury that occurs at the time of the fall, car accident, or gunshot wound. A secondary injury refers to the changes occurring gradually over time, following the primary injury. These secondary brain injuries include cellular, chemical, tissue, or blood vessel changes causing further damage to the brain tissue. Let's take a deeper look at primary brain injuries. The immediate damage to the brain caused by an external force may be broken down into 2 types of primary injuries: a focal injury or a diffusal injury. Damage that occurs in one area of the brain is considered a focal injury, and damage to the brain in more than one area is diffusal. It is common to see both types of injuries in patients who have moderate to severe traumatic brain injury. However, 70% of traumatic brain injuries are diffuse axonal injuries. Let's look at focal brain injuries. Tears in the brain tissue, lacerations, compression, and contusion forces result in focal brain damage, skull fracture, localized bruising, contusions at the site of the injury in both closed traumatic brain injury and penetrating traumatic brain injury. At the coop, which is an injury that occurs under the site at which the external force caused injury to the head, neuronal and glial cell death occurs and blood supplies is compromised, which causes hematoma and epidural, subdural, and intercerebral hemorrhage. Around the coop or contracoop, which is the brain damage that occurs at the opposite side of the primary injury as a result of the brain rebounding and hitting the bony skull, a secondary contusion may begin to occur.
Created using Powtoon.